Current cases in the U.S. updated, the 13th of March 2020, as of March 12 at 3 p.m., there are more than 1,600 cases nationwide and at least 41 deaths. At least 46 states and the District of Columbia are reporting cases. Here is the latest map from the CDC showing affected states, with a color gradient indicating case ranges in each state. Note that the CDC data sometimes lags behind some case reporting by state and local health departments. This map is sometimes missing cases and states, but you can get a general idea of the country's situations. Generally, for a more up-to-date reference, you can check out the Global COVID-19 Dashboard, put together by researchers at Johns Hopkins University. In large CDC, the three states hardest hit are Washington, California, and New York. Washington state is currently reporting 457 cases and 31 deaths. The state reported the first case in the whole of the United States back in January. A Seattle area man in his 30s developed symptoms after returning from a trip to the area around Wuhan, China, where the outbreak began. The current outbreak in the state may link back to that initial case, according to preliminary genetic analyses. New York State is reporting 325 cases and 0 deaths. Of the cases, 121 are from Westchester County, a suburb of New York City that has experienced a large outbreak. California is reporting 198 cases and 4 deaths. The state has housed hundreds of quarantined citizens repatriated from China and passengers from 2 coronavirus-stricken cruise ships. With testing for COVID-19 in the U.S. severely delayed and still dangerously limited, the number of actual cases is expected to be much higher. What could happen if healthcare facilities become overwhelmed? If the situation in the U.S. or in certain communities gets out of hand, and it's not at all clear if this will happen, hospitals and healthcare facilities may not be able to handle the number of COVID-19 patients seeking care. This could lead to suboptimal care for those patients, potentially increasing the case fatality rate in the country. If healthcare systems are overwhelmed, the severe and critical cases will likely get priority, potentially allowing mild cases to go undetected and untreated. This could in turn allow the virus to keep spreading. Again, it is unclear if this will happen. It is a worst-case scenario that can, in part, be avoided if individuals do their part to stop the spread of the disease with hygiene recommendations and mitigation efforts such as social distancing. When will all of this be over in the US? No one knows. Such epidemics are extremely unpredictable, but experts expect that COVID-19 will be with us for at least the coming weeks and months. Will SARS-CoV-2 die down in the summer? So far, we have no evidence that SARS-CoV-2 will be stifled by warming temperatures, WHO epidemiologist Maria Van Kerkhove says. It's unclear exactly why influenza and other respiratory viruses tend to peak in colder months. Some evidence suggests that the lower temperatures and lower humidity may help viruses spread, but we don't know if that's true for this coronavirus. Will it become a seasonal infection? This is also unknown, but some epidemiologists, including Harvard's Mark Lipsitch, suggest that SARS-CoV-2 could be with us indefinitely and that we will eventually see it return in seasonal waves. What about treatments and vaccines? Since the epidemic began in January, researchers have rushed to start clinical trials and begun developing vaccine candidates. There are now dozens of vaccine efforts underway. The National Institute of Allergy and Infectious Diseases at the National Institutes of Health has partnered with biotechnology company Moderna to test a vaccine candidate based on messenger RNA that will cause an individual's cells to produce a viral protein without an infection. An early clinical trial in people is expected to start in the coming weeks. If it is successful, a usable vaccine will still take at least 1.5 years, according to NIAID's director, Dr. Fauci, and that is a very optimistic estimate. Meanwhile, researchers and biotech companies are also working on treatments for COVID-19. On February 25, the NIAID announced that a clinical trial has begun to test whether an experimental antiviral drug called remdesivir can help COVID-19 patients hospitalized in Nebraska Medical Center, UNMC, in Omaha. Researchers are also working on plasma-derived treatments, which have some positive anecdotal reports. The basic idea behind plasma therapy is to harvest antibodies against SARS-CoV-2 from the blood plasma of infected patients after they've recovered. Those collected antibodies can then be injected into newly infected patients, where they could bolster immune responses, potentially improving outcomes and shortening recovery times. On March 4, Takeda Pharmaceutical Company announced that it is beginning work on a plasma-derived therapy for COVID-19.